Hi, I'm Dr. Kelly Starrett with H-Wave. Today we're talking about pad placement for shoulder pain. Now look, shoulder pain can mean a lot of different things to a lot of different people, but what we're really after is thinking about how can I think about moving fluids in and out of the shoulder. So the muscle contraction is going to drive blood flow. We know that's going to happen. And also muscle contraction is ultimately going to work on decongesting or moving waste out of the system. When we look at MRIs and sort of radiographic images and reports from people who've had shoulder pain and getting a diagnostic image, oftentimes we see that the tissue system isn't very healthy. We see kind of tendinosis and latent swelling. So one of the things that we can control very much is moving those tissues out of moving those fluids out of the tissue system. So ultimately, what I want to say is pad placement is less important than you think. And the first time you do this, you're going to find that there's a pad placement that's very comfortable for you, a pad placement that's easy to set up, and ultimately you can even feel free to move around as you get sort of habituated to this. The idea though is if we're looking at the shoulder system, we may be benefiting from putting a little pad placement in the rear of the shoulder, on the rotator cuff, and recruiting some of that musculature. But also let's appreciate that the shoulder is attached to one of the big drivers of power in the front of the body, and that's the pecs and the chest wall. Interestingly is that all of the vasculature of drainage, the lymphatic system, is ultimately going to drain out through the neck. So if we can think about, hey, can I contract some of the big muscles in around the traps, in around the neck, through the pec, we can actually see that we can be bigger drivers of decongestion. Of course, pushing and pulling sort of makes sense. So in this situation, I'm just going to set up Lisa with a pad on the rear of her shoulder. I'm also going to set one up just right on her chest wall, right on her pec here. So I'm just going to put that right on her pec. She can do that herself too, of course. And then I'm going to go ahead and just put one on the front of the shoulder. That could even be lower on the biceps, and on the triceps, just the back of the shoulder. Now we're going to instruct Lisa to turn the power on. She's going to go to low frequency on both settings, because in this situation we're trying to get movement and we're trying to decongest, which is really where we're going to think about making our long-term gains here. And then she's just going to turn this up and get comfortable. And what we're looking for is never a contraction that causes discomfort. So if I'm getting a muscle contraction just by pumping and it hurts a little bit, move the pads around or turn the dials down. So Lisa now is starting to get a good solid contraction in the front of her shoulder, right? She's going to dial this up, and then we can also help her to be thinking about where might she move the pads. One of the mistakes that people make is sometimes we've got to get pad placement perfect, and we don't. If Lisa wasn't liking that pad, she could absolutely just move that pad in the middle of pumping until she got a solid muscle contraction. Remember, ultimately, I don't want to be fighting myself, so if I'm doing a lot of active movements in this, it's going to sort of override some of the signaling we're getting from the device. So, but let's be realists in that, hey, we may not be able to be sort of completely passive and resting in this situation. And so just any contraction that she can get while she's comfortable, laying on the couch, even working, this can be a really powerful way to do a little bit of decongestion, which is one of the reasons we're such fans of this. I'm sitting in class, I'm sitting in the dugout, I'm at work, I'm at home watching the TV. This is an easy way to get lots and lots of movement without motion so that we can have a healthier tissue system. So some ideas on pad placement again, pec, maybe rear of the shoulder, hit the triceps and biceps, but feel free to improvise as you get a little experience.